Hello, I'm Dr. Harvey Smires. I'm a board-certified orthopedic surgeon with the Jim Craigie Center of Excellence for Joint Replacement. And I'm here today to talk about advanced robotic arm-assisted technology for total knee replacement, partial knee replacement, and total hip replacement, which is now available at our Joint Replacement Center in Princeton. Joint replacement is best suited to patients with inflammatory or osteoarthritis, which is wear and tear arthritis. This can come from ligament damage, meniscus damage in the knee, blood supply problems like osteonecrosis, or rheumatoid arthritis. Unfortunately, many patients put off this surgery unnecessarily long because they have fear of pain or recovery. What I tell the patients is we are here to enhance your recovery and make it as quick as possible. When a patient's immobilized with chronic pain, this leads to muscle weakness, obesity, and inactivity. This can also turn into metabolic problems such as diabetes. And chronic health problems can create a downward spiral in their health and well-being. What we're looking to do is to restore their mobility, get them back walking or even in the gym as soon as possible. Robot-assisted surgery offers many benefits compared to manual surgery. It includes shorter hospital stays, fewer complications, accuracy and precision of the implant that's unprecedented, a quicker recovery with less pain, and improved patient satisfaction. It also increases implant survivorship and durability. Many patients come to us focused on short-term results, and yes, most of our patients are up and moving the day of surgery pain-free, but we also concentrate on precise techniques that minimize complications, readmissions, and keep the patients active and satisfied 20 or even 30 years from now. We're using the most advanced robotic arm-assisted technology available on the market today. It's the only one approved for hips and knees and partial knees. It's based on a CAT scan which generates a virtual 3D model which can be manipulated during the surgery. And the surgical plan, once it's locked in, is executed by the robotic assist arm, which also prevents accidental injury to adjacent structures. The 3D modeling allows a representation of the patient's own anatomy in the operating room and enables us to execute the plan with extreme precision. For knee replacement, the robot can also simulate the full range of motion and assure that the knee is in perfect alignment. For hip replacement, the robotic technology allows us to align the cup in position to lower the incidence of dislocation and to verify leg lengths. The biggest take-home message with robotic arm-assisted surgery is that this level of accuracy is unprecedented. It can't be matched by any other system. At the Jim Craigie Center, our surgeons perform more than 1,200 total joint procedures a year. We have a dedicated 36-bed unit, which is all private beds with plasma TVs. It's a hotel-like atmosphere. We have a gym on the floor. Therapy is twice a day, a group session and an individual session. There's a protocol which all the surgeons follow, which leads to uniformly better outcomes and shorter lengths of stay. If you're experiencing joint pain due to a chronic condition or an injury, it's best to visit the doctor for a complete exam. Our expert board-certified orthopedic surgeons are happy to meet with you and talk about how we can help you reclaim your life. Joint replacement surgery can be a safe and effective remedy for a variety of mobility issues to get you back on your feet faster than you've imagined.